Welcome to Knowledge Park. Inside you, a smart cleaning system. It works all day and night to keep balance, not your heart or lungs. It's the urinary system. Today, a quick and simple tour. What it is, how it works, care and risks. Whether you're a student, curious learner, or a health worker, this is for you. Let's begin. The urinary system has one big job. Keep your body steady. That means holding a healthy balance inside. It does this by removing waste. It filters out waste, like urea and creatinine from your blood. It manages water, how much to keep and how much to pass out. It also balances salts, sodium, potassium, and calcium. It filters blood, yes, but it does much more. Your kidneys are also tiny hormone factories. Erythropoietin, EPO, a hormone, tells your bone marrow to make red blood cells. Low EPO can cause anemia. Renin starts a body system called renin-angiotensin-aldosterone system, RAS. It helps control blood pressure and fluid. Active vitamin D, or calcitriol, is made in the kidney. It helps you absorb calcium for strong bones. Four main parts work together, like careful plumbing and recycling. Kidneys on your back, just under the ribs. They are your body's filters. Ureters, two tubes that carry urine from kidney to bladder. Bladder, a storage bag in the pelvis. Urethra, the tube that lets urine leave the body. Meet the team. First, the kidneys, the master filters. You usually have two. Each is about a fist in size, bean-shaped and well protected. Inside are tiny units called nephrons. This is where the real work happens. Think of a smart water filter. The outer part starts the job. The inner part phinem tunes it. Together, they clean your blood again and again, choosing what to keep and what to send out. The ureters are thin, muscular tubes that link kidneys to the bladder. They don't just let urine drip. Gentle squeezes push it along in any position, like a moving belt carrying the cleaned fluid to storage. The bladder is a hollow, stretchy muscle, like a small balloon in your pelvis. Its wall, the detrusor muscle, stretches to hold urine until you are ready. It stores urine safely, like a self-sealing water pouch. The urethra carries urine out. It's shorter in females, so infections are more common. In males, it's longer and also carries semen. A ring-like muscle, the sphincter, works like a tap. You control when you urinate. Let's go inside one tiny kidney unit, the nephron. Each kidney has about 1 million of these little workers. First step is filtration. Think of it as a careful sieve. Blood arrives at a small ball of vessels, the filter. We'll keep it very simple. 3 steps guide the flow. Filter. Step 1. The filter has 3 thin layers. Layer 1 lets water and very small things pass, not blood cells. Layer 2 is a soft mesh that blocks big proteins like albumin. Layer 3 has narrow gaps between feet, allowing only clean fluid through. This barrier can leak in diabetes. Protein in urine is an early warning. A small checkpoint nearby helps control flow. Think of it as a salt sensor checking how salty the flow is. If it's too salty, it signals to gently tighten the entry pipe. That narrows flow to steady the filter pressure. Quick feedback, stable filtering. Now, back to the tube's journey. Step 2. Reabsorption. Reabsorption means taking back what the body needs. Along the tube, we reclaim water, salts, and sugar. In the first tube, we take back the most water, salts, and all the sugar. Down the loop, water goes out to the body, so the fluid gets thicker. Up the loop, salt goes out while water stays inside. Next is the fine-tuning tube, adjusting the final mix. Picture arrows moving useful stuff back to the blood. Here's the map. First tube, the loop, then fine-tuning tube. By the end, almost 99% of the useful stuff is reclaimed. This work uses tiny pumps and energy. In the first tube, one pump pulls in glucose with sodium. Some treatments act here. These can make sugar leave in urine and support heart and kidney health. In the fine-tuning tube, another pump moves salt. Some treatments act here as well. Blocking that action can lower blood pressure. Step 3. Secretion, pushing out extras. Cells push acid H plus potassium and some drugs from blood into the tube. This step pushes out acid, potassium, and some medicines controls pH. Active pumps move those extras into the urine stream. Think medicines and toxins out they go. Extra acid H plus out. Potassium out too. This helps set body pH and clear wastes safely. End result. In the collecting duct, the fluid becomes urine deeper yellow as water is saved. This section is the collecting duct. It makes the fluid urine. What's left is urine, urea, extra salts, and other wastes. It flows through collecting ducts to the ureter. Then it leaves the kidney for the bladder filter, take back, push out steady, all day, every day. Now that we know how it works, how do we keep the system running smoothly for life? Tip 1. Drink water regularly. Sip through the day, carry a bottle. Aim for about 2.5 to 3 liters daily, adjusting for weather and activity. Water keeps urine dilute, helps prevent stones, and flushes germs. Your urine should be pale yellow. Dark yellow means drink more water. Tip 2. Eat colorful whole foods. Fill your plate with berries, peppers, cabbage, fish, and whole grains. Blueberries rich in antioxidants that calm inflammation. Strawberries more antioxidants for protection. Bell peppers low potassium, high in vitamin C and K. Cabbage vitamin rich and kidney friendly. Salmon omega-3s that fight inflammation. Garlic adds flavor without salt, supports blood pressure control. Onions another flavor boost without salt. Oats steady energy and fiber. Brown rice whole grain fiber and fullness. Tip 3. Avoid or limit the usual suspects. Salt your kidney's biggest enemy. Taste before you add. Ultra-processed foods hide salt and phosphorus, read labels. Very high protein diets add extra load, balance your portions. Sugary drinks raise weight and diabetes risk, skip or cut down. Smoking and heavy alcohol damage blood vessels, including those in kidneys. Don't hold urine for long, it strains the bladder and raises infection risk. Tip 4. Move and breathe. Walk daily. Better blood flow to the kidneys. Jog if you can, any pace counts. Cycle or pick any activity you enjoy, just keep moving. Child's pose can gently relax and massage the kidney area. Cobra pose helps open the front body and support circulation. Slow deep breathing lowers stress and blood pressure. Quick checklist. Hydrate, colorful whole foods, less salt and processed. Move daily, breathe calmly. Your gut and kidneys talk. Good gut bacteria from fiber make helpful signals for kidney and heart health. Fiber makes short-chain fatty acids, these calm inflammation and may lower blood pressure. Too much red meat and eggs can raise trimethylamine N oxide, a chemical linked to heart and kidney risk. Go more plant forward. Protein needs vary. In healthy people, higher protein hasn't shown harm. With kidney disease, keep protein controlled with your doctor. If kidney function is reduced, extra protein can drive hyperfiltration. Get personalized advice for the right amount. Even a strong system can run into trouble. Let's look at 3 common problems and what helps. We'll cover UTIs, kidney stones, and chronic kidney disease, CKD. UTIs, urinary tract infections. What is it? A bacterial infection in the urine system. Most often it's in the bladder or the urethra, the tube that carries urine out. Why does it happen? Bacteria from the gut can enter the urethra, more common in women. Common signs: burning while peeing, the urge to go again and again, and cloudy or strong smelling urine. What helps? Drink water and see a doctor early for testing and treatment. Quick action keeps the infection from reaching the kidneys. Kidney stones. What are they? Hard crystals that form from salts and minerals. They start inside the kidney. Why do they form? Urine gets too concentrated. usually from not enough water, or there's too much of stone-forming minerals. Signs include sharp pain in the back or side, pain moving toward the lower belly, sometimes blood in the urine, and nausea. Many small stones pass with fluids and pain control. Prevention starts with water and smart diet choices. Think balance. Promoters like calcium and oxalate make crystals. Blockers like citrate and magnesium help prevent them. Low citrate raises risk. Citrate therapy makes urine less acidic and adds citrate, both lower stone risk. Chronic kidney disease (CKD). What is it? A slow, often lasting drop in how well the kidneys work over months to years. Most common causes: poorly controlled diabetes and high blood pressure. The tricky part? It's often silent at first. Tiredness can appear late, swelling can appear late, and nausea can appear late, often after much function is already lost. Deep dive. Fibrosis. Healthy kidney parts slowly turn into scar like tissue. Scar-making cells lay down collagen and distort the nephron. Research is working to stop or even reverse this scarring. What helps? Regular checks. Start simple. Check your blood pressure, track blood sugar if advised, do kidney blood tests like EGFR, and screen your urine for albumin. When kidneys can't do their job, end-stage disease care shifts to support. Dialysis is one option, an artificial filter. Another is a kidney transplant. With the right care and support, people can live full, meaningful lives. Notice changes like pain, swelling, or foamy, dark, or bloody urine. Don't wait. Talk to a healthcare professional. Early action saves nephrons. Let's peek at what's next for kidney care. First up, regenerative medicine. The goal is to repair, not just replace. Kidney organoids are tiny lab-grown kidneys made from reprogrammed skin cells. They let us study disease safely and test medicines without risking people. Another idea is decellularization. Wash a donor kidney clean of cells, leaving a natural protein scaffold. Then add the patient's own cells to that scaffold, aiming for a closer match and fewer rejections in the future. Next, biomarkers and AI. Instead of one number like creatinine, we can read thousands of molecules in a single urine sample to spot early changes. AI finds patterns, molecular fingerprints, that flag kidney trouble sooner and more precisely. Senolytics, clearing tired cells. Some worn out, senescent cells won't die and send signals that drive inflammation and scarring. These drugs aim to remove those cells and ease damage. Important note, this is in early trials only, but the hope is better function and longer health span. Each advance moves care from crisis to prevention, earlier warnings, gentler treatments, and a real chance to repair. From the humble nephron to organoids, smart tests, and senolytics, we're learning fast. Use this knowledge to care for your kidneys today and look to tomorrow with hope. Advanced tests and new treatments for kidney care. Beyond routine blood and urine tests, how do doctors see inside the kidney? And what if dialysis is not enough? A kidney biopsy takes a tiny tissue sample. With ultrasound, a thin needle collects it safely. Pathologists study it in 3 simple ways. Light microscopy shows the overall structure. It can show inflammation and scarring, called fibrosis. Immunofluorescence looks for antibody deposits, important in LOO pus nephritis. Electron microscopy reveals very fine details. For example, dense immune deposits in some diseases, or a thin basement membrane in certain conditions. Together, these tests give a clear diagnosis and guide treatment. Many kidney problems are immune attacks on the filter. The body misfires and attacks its own tissue. Antibodies and antigens form complexes, which lodge in the filter and cause inflammation. Examples include anti-neutrophil cytoplasmic antibodies associated vasculitis and anti-glomerular basement membrane disease, good Pascher's disease. Strong therapies calm the immune attack with targeted treatments and other supportive care, and sometimes plasma exchange to stop the attack and save nephrons. Dialysis saves lives but is demanding, about 4 hours, 3 times a week, often in a chair. The future aims for cleaning on the go. Wearable artificial kidneys are belt-like devices. They clean slowly and continuously like real kidneys. Benefits may include steadier blood pressure, less washed-out feeling after sessions, fewer diet limits, and more freedom in daily life. Wearable artificial kidney devices are in trials and may bridge to regeneration. Cancer care and kidney care often meet. We call this onconephrology. Simple idea: treat the cancer, protect the kidneys. 2 big reasons. Some chemomedicines can strain the kidneys. They can injure kidneys if not managed. A few are tough on the tiny tubes inside the kidney, so cancer doctors and kidney doctors work together. They give IV fluids to protect the kidneys. They check kidney tests often. They adjust the dose if needed. They may add kidney protective medicines. This teamwork aims to fight cancer and guard kidney health. Another link: some cancers can trigger an immune mix-up. Your immune system makes antibodies to fight the tumor. Sometimes those antibodies also attack the kidney filter. They can cross-react and hit the kidney filter. Doctors call this paraneoplastic glomerulonephritis. Early signs can be protein in the urine or a drop in kidney function. Find and treat the hidden cancer, and the kidney problem can improve. Onconephrology means one goal, 2 teams, 1 patient, 1 plan. Treat the cancer and protect the kidneys. Here's the simple takeaway. Your kidneys clean your blood and balance water and minerals. Keep them healthy with a few daily habits. Drink water. Eat simple whole foods. Move every day. Cut back on salt and sugar. See a doctor early if things change. Pee looks different. You have pain. You notice swelling. Or your blood pressure is high. For kidney issues, see a nephrologist. For surgical urinary problems, see a urologist. For simple UTIs, your family doctor can help. If this was helpful, please like the video, share it with someone, and subscribe for more. Your health is in your hands. Thank you for watching. Take care.